Hey guys, it's Gianna, Midwifay. Today I wanted to talk about childbirth prep classes. Should you take one? Which ones are available? It seems like there's so many options nowadays, and I know that people are overwhelmed with trying to make the choice of one, if they need to take one, two, which one they should take. So I hope this video provides you with a little bit of guidance on my opinion, my recommendations for childbirth prep classes. Let's get into it. So let me first start by answering the elusive question, do I even need to take a childbirth prep class? I think so many of us millennials and Gen Zers, we grew up with the internet, we're used to navigating it, we know how to get information, okay? Google's our friend, YouTube is our friend, and that's great. There is a lot more information at our fingertips now. However, I can say as a birth worker, someone who's been in the hospital setting working for about 7-8 years, despite all the information that people think they have, so many couples are not prepared for labor and what that whole process really looks like. Now, there are some amazing Instagram pages to follow that are very informative. I hope mine is one of them. There are some great YouTube channels. Again, same, I'm clearly in this world. I want you to learn from me through my Instagram, through my YouTube, and I will link in the description box below some other amazing birth workers out there that put out some great content. However, that's just the starting place. The reason we have started these channels, platforms, social media accounts is to point you in the direction of more information for you to really dig deep and educate yourself. Childbirth classes that are comprehensive really can help you prepare for the changes that are going to come with pregnancy, birth, and the postpartum period. I always talk to friends and patients frankly and say, look, how much money and time did you spend planning your wedding? Okay, I'm sure it was an amazing day. Mine was as well. However, the birth of your child, first, second, third, however many children you have, those are also going to be amazing, life-changing days for you. And you need to get a plan in place and really get working on that. And not just, well, I trust what my provider says and I'll do what they say. That's not a plan, okay? You can really be actively involved, and taking a childbirth class to educate yourself is huge. I have 3 main recommendations of how to choose your childbirth class. What I recommend you focus on when choosing what class is right for you. Oh my gosh, there are so many options, and I know that. There's hypnobirthing and hypnobabies. There's the Bradley method. There's Lamaze. There are a variety of virtual or online courses and trainings that people do. There's pain-free birth methods. There's faith-based childbirth class methods, okay? I know that there's a lot. So I hope going through these 3 things that I have will help you hone in on which type of class is best for you. My first tip is for you to really start deep diving into this after 20 weeks, maybe about 24 weeks of pregnancy. That doesn't mean that I don't want you to start talking with your OB provider about things before that, or if there's things you know you want to start researching that. I encourage you, please do those things ahead of time, before 24 weeks or so. However, there are certain tests, ultrasounds, screening procedures that are usually done by this time that will allow us to know, us being your birth team and you, to know if there are certain risks that you have this pregnancy that you need to consider when preparing for birth. So for instance, I don't want you to plan a very extensive plan and look into, an out-of-hospital birth and a class that supports that before you find out maybe that you have a complete placenta previa, which is a complication that generally requires surgical birth. You'll be able to take a class or make a plan after you've done some key testings, ultrasounds, etc., that help you identify your risk status and help go forth in making a plan for your birth. My second big tip is to consider your birth setting. This might seem obvious, but I don't necessarily think it is, because again, I've seen many people do a childbirth prep class that I don't necessarily think prepares them to birth in the hospital setting. Again, I have a video called How to Have an Empowered Hospital Birth, and educating yourself with the childbirth class is key to that. So knowing the setting that you are giving birth in. If you are choosing an out-of-hospital birth setting, either at home or at a birth center out of the hospital, you know, pharmacologic medication-based pain control is not an option for you. So I would encourage you to seek out a childbirth course that's very comprehensive in terms of the physiology of labor and birth, normal labor and birth, and teaches you coping mechanisms to deal with the discomfort of labor. That's going to be very important in an out-of-hospital birth setting. I'm not saying that those courses can't be helpful when you're planning to give birth in the hospital. However, if you plan to give birth in the hospital and would like to use pain medication or an epidural, you don't need a class that so heavily focuses on labor comfort measures and how to deal with labor pains without medication, since that's part of your plan. Considering your birth setting also means considering your provider. Usually when you choose a midwife, we provide and support more physiologic birth, we provide more continuous labor support, and more ways to encourage the natural physiology of the process, versus when you choose an OB for care. So knowing where you're birthing, who your providers are, is going to help you be able to tailor what kind of childbirth education experience you really need. And my third point is to consider your goals and consider your past experiences. If you've given birth before or not, if you've been a patient before, or you've had some kind of chronic illness or something, any interaction with the medical system before, it's really important to take those things into account when planning for your birth. Specifically, if you have given birth before and you had a C-section, let's say, and this time it's a strong goal of yours to have a VBAC, a vaginal birth after cesarean, you're going to want to educate yourself on the reasons, the main reasons for C-section, the best ways to ensure having a vaginal birth, talking to your provider about this. So you're going to want to pick a class that really covers a lot of that stuff in a setting that you're comfortable. Taking into account any previous birth or medical trauma, again, that's also going to be huge. Giving you the language to navigate the healthcare system, to advocate for yourself. That's truly important, given a lot of people's histories these days with traumatic births or traumatic medical things. So after you've done those three things, my recommendation is always going to be for a comprehensive course. So this doesn't mean a 2-hour webinar. Usually it's multiple series to go over multiple topics to include normal pregnancy and birth, common interventions that you might experience, ways to cope with labor, not just one modality or not just going for one way with an epidural, without an epidural, etc. And ways to practice to advocate for yourself, to practice autonomy over yourself, to help your partner and your support people advocate for you. I definitely recommend that. I myself am an evidence-based birth instructor, and I love their childbirth prep course. I would love it if you would sign up with me. My January 2022 series is starting soon. I've only got 5 spots left to register. Please register for it. It's entirely online through Zoom. It's a 6-series course that we really walk through all of those things that I mentioned and really get you prepared and informed to have a truly empowered birth experience in the hospital setting, or really any setting. Please take a look at the link down below to register for the class. I would love to see you there, and I would love to see you birth informed. All right, thank you so much. I hope this helped. I'll see you next time. Bye-bye.